everyone. I am Noelle Descallar and I'm your caregiver for tonight. So I will demonstrate ADL or activity of daily living of the patient. So my first procedure is I will explain the weavers. Okay, so the weavers is for W is the washing hands or washing utensils or hand hygiene. And there are 5 moments of hand hygiene. That is before touching the patient, before aseptic technique, after body fluid exposure risk, after touching the patient, and after touching the patient's surroundings. And for E is for the equipment. So I have to identify all the equipments. It's necessary to identify all the equipments so that I would have an easy movement in my procedure. A, I would announce myself to the patient. So accordingly, I have to knock the door and introduce my name to the patient. So good morning, sir. Good evening, sir. I am Noelle Descallar. So I will be your caregiver for tonight, and I will perform in the ADL to you, or activity of daily living. V is for verify. So verify. Stop muna ka para marinig niya.
Okay, go.
Okay. V or for verify. So I have to verify the patient's name. So in verifying the patient's name, so I have to check the patient's tag. So sir, your name is, while also checking the patient's tag, I have to also to ask the patient, sir, your name is Mr. Muhammad Al-Gurashi. So while asking the name to the patients, I have to look also at the tag, looking the name, the birth date, or the medical record number. And next is I have to explain the procedure. So in explaining the procedure, this is very important in explaining the procedure to the patient so that the patient will be aware of what you will do to the patient. And also, this is also to make the patient comfortable to the procedure. So R is for respect. So in doing the ADL, so I have to respect the privacy of the patient. So I have to close the curtain. So, for example, I have to close the curtain. So let's assume that I have closed the curtain. And as for safety, safety is the very important part because it is also vital for the safety of the patient. So I have to check if the handrails are raised up and locked. The wheels are locked. So okay, everything is okay. Now, I should ask the patient if he is okay or not, the situation of the patient. After that, I will take the vital signs of the patient. So let's assume that I finished already taking the vital signs of the patient. But the vital signs that we should take from the patient is the blood pressure, the temperature, the pulse rate, the respiratory rate. So I assume that we already finished to that, so we will proceed to the next procedure. After that, if we find that the patient is normal, and we can proceed to the urine elimination. So in doing the urine elimination, okay, the first procedure of ADL is urine elimination. In doing urine elimination, there are 2 types, without catheter or with catheter for male. So if there are catheter, if the patient have catheter, so I have to take the urine from the catheter. So we should wear gloves, especially in taking the urine. So I have to take from here. This is when we finish take that. And we have to bring this one in the comfort room or the toilet. And then we should go back to the patient and to take up the gloves and change clean gloves. And now, let's proceed to the without catheter. So now without catheter, so we have to unfold the blanket. Exposing the genital area of the patient. But as much as possible, we have to cover that one unless we do the procedure. Now we have to take the urine of the patient. So we have to ask the patient to lift his knee so that we could place the urine basin or the tube. And then we have to place this one, cover this one with the toilet paper or anything that could cover. And let's go back to the and you have to leave the patient for 3 to 5 minutes and for the patient to give time to eliminate the urine. So after we assume that we can, after 35 minutes, we will take the urine. So in taking the urine, we have to we will ask the patient if he could wipe his genital area, or we will do it. So we have to wipe the genital area, and then take the urine to the toilet and eliminate the urine. Next is for in the a female patient. In a female patient, we will use the basin. So in taking this one, we always should remember that we have to change gloves every time we do the procedure. Every time we touch the patient, we should always have the clean gloves. And then we have to fold this one down. And ask the patient if the patient is
sideways.
Yes, I forgot cider. Ano hindi magsasabi?
Close.
No, sabi pa